Today we're talking about osteoarthritis of the hip joint. This is the third most common arthritis in the body. It affects millions of Americans and it's a debilitating, painful condition. Some of the most common symptoms: as soon as you get up from a chair, you have that aching in your hip, sharp pain, some difficulty sleeping, inability to walk properly without sharp pain. There's redness, heat, and inflammation as well. What are the top 3 causes of osteoarthritis of the hip? Definitely obesity. With a higher BMI and a larger stomach, you're really increasing strain and stress on that hip joint. The older we get, the more worn down our cartilage gets in our joint, so that wear and tear of our cartilage as we age. And a previous injury to the hip, the back, or the knee could actually alter your gait pattern, which is your walking pattern. So if you start to limp, then it definitely can affect the mechanics of the hip. There's a very safe cartilage that's built into that ball and socket joint, and that cartilage wears away. But guess what? There's an answer, a real good answer to help with osteoarthritis of the hip. Physical therapy, number 1, can really help. I've got Stacy here, and we're going to show you the top 3 exercises that can really help build the muscles around the hip joint. The first exercise is called a clam shell. She's going to show you 3 modified versions of this. You're going to lie on your side, you're going to put a band around your knees, and you're going to lift your knee up. You should really be focusing on the glutes. The glutes are the primary weak muscles that contribute to osteoarthritis of the hip. You've got to strengthen your glutes. The second option that's too difficult, really keeping your toes together and lifting the knee up, you should absolutely feel a good burn in the gluteus muscle. If you're feeling this in your back, stop. You need to focus on the glutes. They're the primary cause of this problem. And the third option is we call the dipper. Dip your knee down, rotate it up to the sky. We dip the knee down and rotate it up. You should do anywhere between 10 to 20 reps. Make sure you're feeling a burn in the glutes. The second exercise that helps with osteoarthritis of the hip is a hip bridge. You're going to be lying down on your bed or the floor with a nice firm mattress, and you're going to make sure that your feet are in line and your knees are in line. You're going to lift your buttocks off the bed, squeezing the buttocks. Again, the weakest link here in arthritis. You should definitely focusing on squeezing the gluteus maximus muscle as if there was a penny stuck between them, and really feel that burn. The other option, if this hurts your hamstring and you feel a cramp, bring your legs straight out. Dorsiflex the feet up or pull them towards your chest, and you're going to lift and squeeze the buttocks. This is an alternate bridge and a really wonderful exercise that actually can also help you get in and out of the bed. The third exercise we're going to show you is actually a stretch. Muscle imbalances are another main factor in knee arthritis and hip arthritis. So when you have an imbalance in the muscles that surround the hip, it's going to make the pain worse. We are demonstrating a wonderful hip flexor stretch and quadricep stretch by using a special band. You can get a little rope, tie it around your foot, bring it over your shoulder, and pull back. You should feel a nice pulling sensation, not a pain, in the front of your leg. How long should you hold a stretch? 2 minutes. Let's face it, sitting is the new smoking. These muscles get shortened from sitting. We must stretch them to help fix hip osteoarthritis.